and Youth Services Bureau, and they want to really know where people sit and where they stand and who is responsible for what. We're also going to talk a little bit more generic about the Runaway and Homeless Youth Rule, and I know many of you heard this morning that it has not been published, so we're going to share what we can at this point in time. We're going to talk a little bit more about the Runaway and Homeless Youth HMIS integration with a workshop that's forthcoming tomorrow morning. We've continued to work on our Transitional Living Program impact study, and we'll also share some more information about that new funding opportunity that came out, and we awarded 9 grants to do work as it relates to LGBTQ youth and youth aging out of foster care. And then we'll share a little bit more about our FY 2017 funding. So here's where FISB sits within the U.S. Department of Health and Human Services. So it's within the Administration for Children and Families, the Administration on Children, Youth, and Families, and then we have my division that has the Runaway and Homeless Youth Program and the Adolescent Pregnancy Prevention Program. And so this is the organizational structure for FISB. But what I wanted to do at this point in time is to really take the opportunity to introduce our staff, because we've had a lot of initiatives that you heard this morning from both Commissioner Lopez and from Deputy Associate Commissioner Debbie Powell. And so none of this could be done without the staff. And I have the privilege of working alongside all of them and very happy to do so, because we have a multidisciplinary team that bring a lot of rich energy and passion and skill sets to this team. And so I'm going to start with the fact that for the first time ever in the Runaway and Homeless Youth Program, we actually have 3 regional program managers. And I do have to give a debt of gratitude to both Commissioner Lopez and to Debbie Powell for their foresight to make that happen. And so I'm going to start with them. So if they're in the room, if you could please stand so people can acknowledge you. So we'll start with Region 6, Keith Wallace. He's in the back of the room with his hand waving. And Keith comes to us with many, many years of experience, because he used to be a former Runaway and Homeless Youth Grantee. And so in Region 7, we have Aaron Kelvington. And also in the back of the room. And then last but not least, in terms of the regional program managers, is Jeff Daniels. And Jeff started with us in October. He's over there in the middle of the room. But I also want to take the opportunity to introduce, and I think many of you have known, Chris Holloway, who's our Central Office Program Manager. And so we also have, for the first time ever in FISB, a policy division as well that reports to the Associate Commissioner and Deputy Associate Commissioner. And we actually have someone here from our policy division, Kimberly Waller. And then from Central Office, we have Gloria Watkins, and I saw her walk in the room. Gloria, up front here. And so a huge thank you to Gloria, because she works with National Safe Place to help put on this conference. And we also in Central Office have Peter Nitsevich, who's been with us about a year now, and his role is really to help us with the RHYMA's HMS integration, and has done a lot of work, and we've seen a lot of movement based on his efforts as well. And then in Region 1, unfortunately Megan Byrne was here but had a family emergency and had to leave. For Region 2, we have Asita McGee. So Asita is over there in the corner. From Region 3, we have Habiba Suleiman Smith. From Region 4, we have our newest member, and she's been with us a little less than a month, Alicia Parks from Region 4 in Atlanta. Region 5, we have Nikki Lee. And from Region 6, we have, of course, Keith Wallace representing Region 6, and Region 7, we have Aaron Kelvington. And for Region 8, we have Deb Yatsko, up right in the middle. Region 9, we have Deborah Oppenheim. And last but not least, we have Region 10, Steve Ice, also in the back there. So this is just to give you an overview of the staff, but to also let you know that we have new staff. We're happy to have them on board. I know I'm definitely relieved for them to be here and very excited with the energy they bring and the skill sets they bring to help really continue to shape the work that we do. And so I'm actually going to turn it over right now to Kimberly Waller to give you an update on our runaway and homeless youth rule.
Good afternoon, everybody. So I know 3:30 is kind of the, like, you hit your lull moment, and I have the pleasure of speaking to you about a thrilling topic, federal regulation. I think it's going to be very exciting. But in all seriousness, it's really been, so I've been in this position for 6 or 7 months now. And came into this office and hit the ground running with this regulation. It has been truly an honor to be working on it. I think it really reflects a lot of the work that the field has already been doing, and just continues to push RHY programs to be leaders in this field, and to make really good change that will be positive for the youth that we all serve. I have to multitask here. So continuing on with kind of the overview, I know we all know the Runaway and Homeless Youth Act, but just kind of a quick overview. The RHY Act provides authority for 3 major grant programs: Street Outreach Program, Basic Center Program, Transitional Living Program. It's been so fascinating for me to learn about all of the innovative stuff that our programs are doing. I actually come more from the child welfare side, and started off on the Hill doing legislative work in this area, and so learning this side and seeing how these systems are so interconnected, and just the amazing work that your programs are doing, it's been really amazing. And of course, we also have funding authority for demonstration projects and for national communication systems, data collection, research, grant monitoring, TNTA, so that's kind of a broad overview. And RHY is over 40 years old, and I think it's a relatively new area for me, but I think for a lot of you out there, it is not. You have been doing this work for decades, and we have a lot of knowledge in this room and a lot of knowledge in our programs that is just really important to lift up. I think I kind of nerd out sometimes whenever I research a bit of the history of the RHY program, but I was talking to Chris about this a little earlier, but it's really interesting to see kind of how much RHY programs have evolved. I think, in the 70s, it was really a response, obviously, to giving the youth that we serve another option other than juvenile justice. And so really kind of coming in and creating programs that can really respond to the actual needs of these youth. And some other information, I think we've heard a lot about, in random conversations that I've been in, the authorization has expired in 2013, and so that's kind of an area that we're going to be working in. But the history is really interesting, and the last time it was reauthorized was by the Reconnecting Homeless Youth Act in 2008. And as part of that reauthorization, it required the Department of Health and Human Services to put out rules that specify performance standards. So that is why we are here today with these rules. And so the first step, this is kind of a background of what the process has been. I know a lot of you already know some of this stuff, maybe some of you don't, so forgive me if it's repetitive. But the first step in the rule process is publishing the proposed rule. So we received feedback from the field in drafting this. I think that's really important to acknowledge, that while we had legislative authority kind of telling us certain things we needed to do, we also hit you guys up and figured out from people doing this work on the ground level what is needed, and where we need to go with our programs to continue to improve outcomes for the youth that we serve. So an example of that is in April in 2009, FISB conducted a consultation forum that brought together 44 individuals to kind of talk through what this rule needs to look like and where we need to go. So the Notice of Proposed Rulemaking, the NPRM, it was published in the Federal Register on April 4th, 2014. and public comment ended on June 13th, 2014. So we give the public 60 days. This was long before my time in FISB. I think long before some others on the stage's time at FISB too. So this has had a lot of people working on it, a lot of hands touching it, a lot of passion put into it. And so we received 72 responses and unique comments or sets of comments on the proposed rule, representing about 300 individuals and organizations providing comments to the rule. And just kind of a rundown of what the NPRM looks like. And just to, I mean, I know we all know this now, but the rule is not final. It has not been signed yet. We are still full steam ahead working on this. And just to kind of give you what the proposed rule looked like, it's made up of the preamble, which if you read it, it's kind of a summary of why we've decided to make the regulation, the draft regulation, what it is. And then it goes into the rule. And that's where you kind of see all of the sections, and it's a little bit more of the wonky regulatory language. And so when the final rule gets published, it will be similar. It will have a preamble and it will have the regulatory language. So these are kind of some high-level questions that the NPRM was designed to try to answer. And so those kind of include what costs are and are not supportable under RHY grant programs, what additional requirements may apply, as we stated previously with the legislative requirement, what performance standards must RHY grantees meet. So those were all questions that were kind of posed with the NPRM, and we received comment on all of those. And so what's next? The final rule it will respond to all of the public comments and revises the rule as necessary to reflect those comments. So I think this is the thing that I really want to lift up, is that this has been a collaborative process with the field. You know, I think you all out in the field and out in the country know how your programs are going to react to these regulations, and so getting feedback from you has been really crucial. And I also want to emphasize that the final rule, while it has public comment, it also goes through a process in the federal agencies. So our sister agencies and federal partners all review this rule and have an opportunity to comment, ask questions, kind of work through what the rule looks like. So we've had HUD, Department of Ed, Department of Justice, the White House, everybody looks at this rule so that we are all on the same page, because all of our programs that are working in this field are working to end youth homelessness and to transition youth successfully into adulthood. And I think it's really important to lift up that we're doing this collaboratively. I know we talk about and hear about silos regularly in the federal government, but this is an opportunity that we've had to really get shared input from other agencies and work towards the common goal. And so once the final rule is published, the real work truly begins. Implementation is really huge with this. You know, you can have a rule out there, but if it's not implemented or implemented well, it's meaningless. And so this is an opportunity, again, for us to work collaboratively and together on implementing this. And I think there is going to be the policy team and everybody up here is going to be working really hard to make sure that we get information to you regularly, additional guidance and policy, frequently asked questions. And I think it's important to know that these are going to be kind of living, breathing documents. They're not going to be just static documents that we just, you know, post up. We're going to be changing them and reflecting the needs that you all have and the questions that you all have. And you have, as you've seen, everybody out in the regional offices are resources for you. And I think that it's going to be, it's not going to happen overnight, and we're going to work together and get to where we need to go with implementation. And I also want to just make clear that the policy team and FISB and the Runaway and Homeless Youth Program is really dedicated to getting a system. You know, the last time we had any regulations in the RHY program was in 2000. And so this is going to be a process, and we're going to work together in doing it. And I think, yep. And now my colleague Peter is going to come up and talk to you about data.
Thanks, Kimberly. Who here loves data? All right. That's actually a lot more people than I was expecting. I was expecting to be the only one. Who is currently recording data in HMIS or uploading? Okay, so this is the right people to talk to. Um, who is using the data in HMIS besides just uploading to the feds to make decisions either on a client level to help make decisions about your particular youth or to help make program decisions about your program? We have hands up. So my hope for all of us and you is that by the time we speak here or somewhere else next year, half of the room will raise their hands, and in 5 years' time, we'll have the entire room raise their hands. Because we're coming to an age where the data that we collect, the data that we upload, the data that we share is being used to help guide decisions about what is best for the youth and families and that we serve, and what is best, and how to best meet their outcomes. So I wanted to kind of walk to you, and I apologize, please ignore the text kind of in the middle of the slide. The data process, so far, since 2015, we have integrated our data system, as you know, with HMIS, which is traditionally HUD system, but it's no longer HUD system, it's our system. You're the customer of HMIS, just as COCs are the customers of HMIS, just as a lot of VA medical centers and VA facilities are customers of HMIS, just like SAMHSA path grantees are. And also a lot of non-federally funded, community funded, state level funded, philanthropic funded organizations are using HMIS. And all HMIS is, it's more than just all, but it's a platform for allowing you to collect, share, understand what is going on to the youth that you're doing in an objective way. So you're not just guessing, oh, I think I served 2 youth yesterday. You know that for sure, and you know what their issues are. It feeds into this larger aggregate format where we know how many youth your community has served, what their outcomes were, what the length of stay was, how many youth were served in your state, and then how many youth were served in the nation. Related question, also important, is how many youth were not served, and what can we do about that? So what I wanted to go, I hope this is helpful, and what this cycle is basically, I guess, my vision for the federal and the local systems, how they should be interacting with each other to be able to go from just collecting data to really using the data to implement policies and practices to improve outcomes for our youth. So I'm not going to go through this in detail, but really quickly, what we have done is we are really on steps 1 and 2. We have set up the standards and the systems for you, and you have set up your local systems. You have all collected data. Now a lot of you are uploading the fiscal year 16 data, so this is your 3rd upload for many of you. But a lot of you, and a lot of us on the federal level, are not sharing data. We need a more consistent, more user-friendly, more understandable, youth-empowering approach to sharing data, meeting confidentiality requirements, meeting privacy requirements, but also promoting the larger picture of what is happening to our youth in our systems. What we haven't done as good of a job of on the federal level is gaining insights. How do you have all of this data to really come up with the best kind of strategies and policies to be able to do more of the good stuff and hopefully do less of the stuff that doesn't really work for youth? So again, I hope this schematic is helpful to you. I did want to make sure the youth are in the center of all of this. And you know that the youth are not just ones and zeros. To the computer they are, but to you they are all of the stories and all of the faces that you see every day. So I wanted to touch upon 3 quick things that I have been busy working on that hopefully will help you, because we have to get to that cycle, we have to overcome a lot of barriers, and we're getting there, but it's also a long-term process. So the 3 things are sharing data, improving data quality and accuracy, and also disseminating data for the wider audience. So in terms of data sharing, I think a lot of you are familiar with the kind of RHY rule in terms of if you want to collect data, you do not need consent. So let me repeat that. Just by entering data in HMIS, you do not need to ask the consent of the youth or their parents just to collect data that will be safeguarded within that project within HMIS. However, if you want to share data, and this is where really the effective approach is to understanding at the community level what's happening with your youth, is you need to share data so that if a youth enters our street outreach program one day, but then appears in a HUD-funded rapid rehousing program the next day, they know, the community knows this is the same youth and they are bouncing from in different places. And the way to do that is through sharing data, and that does require consent of the parent or guardian and the youth assent for youth under 18, as well as the youth consent for themselves, 18 and over. I'm not gonna go into more than that at this stage. But something we want to do on the federal level is we want to increase the best practices. And to do that, we might want to put out guidance, webinars, clarification, and when there are conflicting laws. And we also want to safeguard youth's rights, right? This, after all, it's sort of our data, but it really belongs to the youth, right? Because it's their story and it's their personal information. A lot of times it's very sensitive stuff. So there's a reason why there's such an emphasis on privacy and confidentiality. And so I think from our viewpoint, we need to better empower you so that you understand all of the laws and regulations affecting confidentiality and privacy, so that you can easily work with the youth and explain to them, is this the right choice? Do you consent to data sharing? And it truly becomes informed consent, or they truly say, no, I don't want to share data, but that decision was based on an informed basis. So second of all, we want to improve data accuracy. So data is great, but data is garbage unless it represents something accurate. And we are in the middle, we are, doing right? So we're doing okay on some elements, and some of you are collecting great data. Nationwide, we don't have comprehensive great data that will say, okay, we need X to be able to meet our goal of ending youth homelessness. And so I want to show you this graph that kind of explains what are the kinds of questions that youth are not answering or you are not submitting to us, and then the kinds of questions that you are submitting to us. So in general, you guys are doing a great job collecting information on the youth's ethnicity, race, where they were prior to entering your program, what their gender is, and where they are going after leaving the program. But then not surprisingly, when it comes to the really sensitive stuff like what's your social security number? Have you ever been a victim of domestic violence? What is your, have you ever been a victim of sexual or labor exploitation? Or even, are you currently working? Which to me is surprising that that's one of our lowest elements. But those are, some of the fields that we need to work on. And it means that you guys need to work on gathering that data, but it also means that we need to work on better empowering you to ask that data, because we get that you can't just ask a youth on the street, what is your social security number the first time you see them. And so our task is to really provide you with the right tools for you to be able to record this data in a way that's youth appropriate. And here's just a picture of the data quality report that a lot of you have been seeing in your inboxes as you complete your upload, to kind of list all of the, not all of the elements, but the some of the most necessary elements, the elements that are that really help tell a picture, and how you guys are doing in terms of data completeness. So next steps on this is, as I mentioned, we need to do a lot more training for you guys, and so that's my pledge to you as we go down over the next year. We will continue doing that. we will release an HMIS manual that will help you understand what is this field and when do I put this versus that. That manual will help explain a lot of these questions. We also need to, in light of what Kimberly has been saying about the rule, as we move towards this kind of data-driven approach, we need to revise our data standards so that the information you're collecting matters to you, matters to your state, matters to us. So right now, there's a lot of fields you're collecting, and they're not all important. We are not using all of them. That means we have to take out the ones we don't really care about, and we have to add or change the ones we really do care about, because I think all of us want the best for the youth. And as we've heard from from many of our federal partners about the federal framework, we want not just to provide youth with safe and stable housing, we want to improve their education and employment outcomes. We want to connect them to permanent connections. We want to improve their well-being. And so those are the data standards. It's with that kind of approach where we'll be directing the revision of the data standards. So third thing is, one of my favorites, is using aggregate data to make the case. The picture you see here is our soon to be published, and soon is with an asterisk in the federal government, dashboard, which is the total sum of all of the data you have uploaded to us. It provides you with visual graphs and charts and interactive features to be able to drill down what it is that you want to know about national data. And for you, there will also be a special login, and your project officer will also have a similar login, where you'll be able to assess your program data compared to your state or your region or the nation. And so then it's apples to apples. If you think you're doing well at sending youth in your BCP to safe and appropriate exits, how are you doing compared to the program next door or the program in the next city? So this will be hopefully a great tool for all of you and other researchers and policymakers and the public to use to really use the data that we all collect and upload for our larger goal. And so the next steps for us are to launch this dashboard. And just like with the collecting the data, we need to train you so you know exactly how to use the dashboard. So look out for that. I said soon. Honestly speaking, there's a lot of IT-related challenges to get there, so it'll most likely be sometime in 2017. And before I turn it over to the next presenter, I just wanted to mention a couple of other ways you can use me and other partners here at this conference. So attend the workshop tomorrow, which is at 10:45 in Tarpon Key. We'll get into many more specifics about RHY HMIS. We've also had, and we'll have another session tomorrow, one-on-one consultations. So if you have a very specific question about your program or your upload or your community, let us know. Those times are listed. Tomorrow will be 15-minute sessions from 2:30 to 5 o'clock. And sign up at the AIR table in the main lobby. While you're at the AIR table, you can ask questions, grab any of the materials. Also use that RHYMISservicedesk.net website to submit any technical questions you might be having about the upload. And finally, that last email address will go straight to me, rymis@acf.hhs.gov. If you have any questions related to HMIS as it relates to RHY programs, or really have any other kinds of bright ideas, what are we doing wrong, what are we doing right, what would you like to see so that we better serve youth in terms of data, use that email address, and I love reading and responding to your emails. So that's that, and I'll turn it over to Risa.
So thank you, Peter. And I just need a show of hands. How many of you have transitional living program funding? Wow, quite a bit. So I think in terms of presenting information related to research and evaluation, I had my good friend that I met this morning at the networking session, Tim, say that I should sing it to give it some life. And my response to him was, I drive you guys out here in droves to the beach. So I'm really just going to present the information and very happy to do so. So we've named this initiative STARS because it's related to our young people in our transition living program, and they are the stars that we work with every day. But it really stands for Successful Transitions to Adulthood Research Study. And so we know that for the last 25 years or so, we've been implementing the transitional living program, and we really don't have any empirical evidence to really look at the effects of our transitional living program on the youth served, and we want to get this information that will really help inform federal policy as well as local practice. And so in order to help bridge that gap or fill that gap, the STARS program is really a congressionally mandated opportunity for us to really look at the impact of our transitional living program on the homeless youth that we serve. So it really does have two components. And for the researchers in the room, we have an implementation study really to describe the TLP program models, or what we call a process evaluation. And then we have the impact study, which is really looking at a random assignment designed to look at youth and outcomes specific to youth. Because I think many of you know that we have shared ownership in the outcomes for youth. We do it at the federal level, but you do that great work at the local level. And so when we actually collaborate and partner the way we've been doing as part of this transitional living program impact evaluation, I think we will see that we can move mountains with that process. And so just to give you an overview of some of the grantees that are participating in the study, we have 13 grantees involved, and they're valued partners as part of the process. And I think the 13 grantees that are participating in this really have a critical, will have a critical impact on the success of this particular initiative. And so you can see the grantees are located all throughout the U.S. in terms of having representation for rural, suburban, and urban areas. And then also, for these 13 grantees that are participating, the goal is to really enroll 1,250 youth, which is really the number or the sample size needed to really detect the impact of the TLP on youth outcomes. So I think you're going to hear this over and over. We talk about the opening doors or the federal strategic plan to prevent and end youth homelessness. And so you will see that based on that particular youth intervention framework, those are the same outcomes that we continue to highlight. And so as part of this evaluation, we're looking at really 35 different outcomes grouped into these four categories for youth. And so it's, again, housing stability, positive social connections, social and emotional well-being, and attachment to education and or employment. And I think that as part of this initiative, we're looking at a comprehensive data collection set to really look at the outcomes for youth. So for example, we're asking questions about youth housing, we're asking questions about youth self-esteem, self-efficacy, really looking at their trauma, looking at their substance use and behavioral health issues as part of this particular study. And I think we'll definitely have some rich outcomes to report as part of the study. So related to this, we talked about the implementation study, and this is part of the process evaluation. And it's really looking at how are you implementing your transitional living program? How are they structured? How are they operated? How are they staffed? What services are being delivered? And how are they being delivered to youth? And what program features and service delivery approaches do tend to influence youth outcomes? And we have engaged, and this is a partnership. When I say that, it's a partnership with you, but we also have a contractor that has started the process of visiting or conducting site visits to those 13 organizations that are participating. And as part of that process, they're conducting interviews with a lot of the staff, as well as working to train staff on how to implement the random assignment component to this evaluation. So just to talk a little bit more about the data collection pieces, so we have the process evaluation, which is really collecting qualitative data as part of the interviews. With the youth, it's the opportunity to collect quantitative data through surveys. And we have them at we have baseline once youth enter the program. We have a 3-month survey that really focuses on what we call dosage data, or looking at the comprehensive services that youth receive as part of the study. And then we have a 12-month follow-up that's really a longitudinal study as it relates to the second phase of what the baseline entails. But not listed here, we have what we call touch points, which will be at 6 months and 9 months, really to make sure, because we know that youth are transient. And so these are 2 opportunities where we'll just have touch points using social media to ensure that we are still in contact with youth, and we're able to administer the 12-month survey as well. And so we're actually using technology as part of this. I think we look at the opportunity and how do we continue to engage youth, and the use of technology where they're able to go onto a website and take their surveys. And we're also adding some incentives to that, because we know that if you're asking youth some personal questions, they're not likely to be truthful. But our hope is that if they're able to take this in the privacy of their home or where they're residing at a public library, that they're willing to be more honest in terms of answering some of these questions, because some of them are very sensitive. And so, as with any study, it's not without challenges. And so we've heard a lot of the grantees push back, and we appreciated that. And so based on that, we've heard you. And here's some of the features we've designed to really address some of the concerns you have. We have what we call control crossover. And so essentially there was the concern that if I'm assigning a youth to the control group and that leaves a bed open in my shelter, I don't want to leave that bed open for any length of time. And so to address that concern, we worked with our contractor to ensure that youth in the control group will then have a random chance of being crossed over to the treatment group, or youth in the treatment group, to make sure that no bed stays open for any length of time. A lot of the grantees said that the work that they're doing to make sure that they're touching points with youth it was an additional financial burden. So we worked to increase the incentive that we're giving to each of the 13 sites that are participating. And then we have what we call 3 free passes. So we know that sometimes youth come in crisis, and there's no way that you're going to feel comfortable assigning that youth as part of the random assignment. And so each of the 13 sites have 3 passes where they can just assign youth to that shelter and not have to have them participate in the study. And so, in addition to addressing the concerns, we made the decision to go with a pilot study of this initiative. And the reason why is we want to make sure that we're implementing now control crossover. Will that be successful? How often will we need it? Will there be a huge attrition to our control group because a lot of them are crossing over to the treatment group? We also wanted to look at, will we be able to meet that sample size of 1,250 youth as part of this? And so we're looking at what we call oversubscription as it relates to each of the organizations, meaning that they have a lot more youth coming in their door than they're able to serve. And so then they have what we call a waiting list. And so we are essentially couching the waiting list as the control youth who will still be receiving referral to services, but will not be part of that TLP shelter, obviously because they're oversubscribed at that point in time. And so, it's a 5-month pilot. We've just recently launched it, as I mentioned, with our contractor going out and conducting the site visits and interviewing staff and training staff on how to do the random assignment. But it's also an opportunity for us to partner. We've been partnering with, as I mentioned, the 13 grantees, but we've been partnering with our Office of Planning, Research, and Evaluation with an ACF OPRE. And I just wanted to list some of the staff who are working on it in central office, as well as our contractor. But happy to take any questions at the end of this session if you have any about our Transitional Living Program Impact Study. And so I am going to turn it over to my colleague, Chris Holloway.
Thanks, Teresa. Well, so I'm the only person standing in your way between fireworks and a reception. Fireworks, yes, absolutely. It's not just little poppy things, it's actual real fireworks from what I understand. Courtesy of the Visitors Bureau here in Greater St. Petersburg, so we're very appreciative of that. We've talked a lot about TLP from the evaluation study, and I'm going to talk about the demonstration program. So I get the sense that maybe the BCP programs and the SOP programs are not feeling the love in the room right now. So what I would like is all of our TLP program folks to stand up, please. Interactive session. All right, everyone else is sitting down is either a BCP or SOP, so you need to give them a hug, or shake their hand, or show them some love, because we don't want them to go feeling as if they're not appreciated. All right. So, we talked about the evaluation. Whoops. Now we're going to talk about the demonstration program. And before, one more instance where I'm going to ask folks to stand up, but it's a small group. If you are one of the 9 demonstration sites for the TLP demo, can you please stand up? All right, let's give them a round of applause. Thank you. It was a very competitive process for what amounted to a very limited amount of resources, and so they reflect programs across the country, literally from Maine to Seattle, from Florida to Ohio, and in New Mexico. And they cover the spectrum of programs. Most are going to be focusing on LGBTQ youth, and a couple are going to be focusing on youth aging out of foster care. We were fortunate. We had put forward in our request for fiscal year 2016 funds a specific amount of money to do some type of demonstration initiative focused on LGBTQ youth. And we've heard the numbers. Commissioner Lopez mentioned it this morning when he talked about the Street Outreach Program report. We are all very well aware of the data that shows that, unfortunately, LGBTQ youth are overrepresented amongst the population of runaway and homeless youth, as well as our youth coming out of foster care and child welfare. It's one of those things that, the study tells us something that we already know. But what are we doing about it? How are we making an effort to address the needs of those young people that are different from the needs of other youth? We instituted years ago the maternity group home program because we recognized there was a need amongst youth that were over the age of 16 that fit within that TLP paradigm, who were pregnant or parenting runaway or homeless youth. And so a wise decision was made to implement a maternity group home initiative. So we look at this in very much the same way. This is an opportunity for us to gather good information about the type of work and efforts and strategies that you, as in those 9 demonstration sites, are deploying to see how we can replicate that down the line. What information can we gather from the implementation process, from the structure of how you identify, how you intervene, in how it is that you follow these young people through the life of the TLP program. And so, as you all know, TLPs are typically 5-year programs. We only had authority to do 24 months with this money, and so these are truly demonstration sites in the sense that there's no more money to follow afterwards. The 24 months goes, the money that goes out the door is all the money that they have, and we're hopeful on the back end that we're able to see not only through the process of how it is that they engage with these young people, but through the actual strategies they employ, that there are things that we can then in turn communicate back to you as really effective interventions and strategies that can then be replicated across the country for LGBTQ youth and those aging out of foster care. And so we have an evaluation that is actually dovetailed with the evaluation that Risa was just mentioning for the broader TLP program. It's the same researcher, but we've also encouraged those local grantees to do their own evaluations. Look within themselves at the different strategies that they're employing, the efforts that they're taking, so that we can not only see an individual snapshot of that particular organization, but then we can look broadly across those 9 sites and see where there are good highlights, where there are positive focus, and where things didn't work. And frankly, well, we have to be honest about that as well. Demonstration initiatives are often as much about what didn't work as they are about what did work. If we go into any research question with the theory that we think this is the answer, in many ways we're looking to do either one of 2 things. Answer the question in the affirmative or disprove the answer that we assumed was the correct answer. And that's in many ways what a demonstration initiative does, is it gives us the opportunity to say, well, we think this is an effective approach. This is an effective strategy. And after the 2 years, hopefully we come to that conclusion, but in some instances we don't. Much of what you've heard over today, this morning in particular, certainly in Risa's conversation about the TLP outcome and project study, this is reflected in the USICH core outcomes. It's a message that we're repeating over and over again about permanent connections, stable housing, emotional well-being. We're looking for those same things here, but we're looking for a framework that enhances and it provides stability and structure for a young person who is LGBTQ or is coming out of foster care after aging out of the system. And so we're looking at a process here that creates a pathway for these young people, gives them a trajectory towards success, no different than any other TLP program, but one that is sensitive to their needs as individuals and identifies the unique circumstances that they may face coming from the background that they do. We don't always have that luxury in our programs. We're often having to apply a general approach to all the young people that come into our shelters and through our SOP program. Here, we're getting a little bit more latitude. We're saying we're going to focus, pinpoint, laser on what your needs are as a member of this group, as someone who needs some specific attention from us. And we've talked about it a couple times, LGBTQ youth who are 16 to 21, standard TLP model, as well as those that are aging out of foster care, 18 to 21 years also. The 9 grantees that were awarded had the option of doing both. If they had the capacity, they could, in fact, align their services to both target populations. That's a lofty goal. There's a lot that goes into being able to do a demonstration initiative where you're targeting what amounts to pretty significant populations. And so I believe only one of the 9 ended up putting forward a proposal where they were going to target both populations. And so the project, much like the work that you're already doing, does include an intervention, it does include a screening process, and ultimately at the very end, it's safe and appropriate and stable housing that promotes self-sufficiency. And again, what we're hoping to get on the back end of this is a reflection of programs that have some efficacy in providing strategies for these young people who are part of these populations. And you're starting to hear a theme, right? Stable housing, permanent connections, education and employment, social and emotional well-being. These are things that we know that are part of the strategic goals for the strategy to end youth homelessness in 2020. They're being incorporated into our overarching goals and objectives in the Family and Youth Services Bureau and the Runaway and Homeless Youth Program. And so get familiar with them, know them. These are the things that are going to accompany our programs for the future. They're already in the funding opportunity announcements. You've already seen them through the USICH and the strategic plan documents. So they're now the focus of this demonstration initiative, and it's a great place for us to dovetail what USICH has put forward in their strategic planning documents with this effort to address the needs of these two populations of youth. The demo evaluation is not going to be as robust as the TLP impact study that Risa explained. We don't have the resources, quite honestly, and more so than anything else, we don't have the time. The reality is we only do have 24 months, and so we have to get in very quickly, understand how it is that these 9 sites are proposing to facilitate efforts towards these two populations of young people, and then glean some information both from the local data that they're collecting as well as some numbers and some information and data around the global initiative, the 9 groups that are part of the TLP demo. There are going to be interviews. We're going to have conversations with young people. The robustness here is the thing I can't underscore enough. We just don't have the time to gather as much information as we would like. And so it really is incumbent on the local sites to do their local evaluation, to document the young people that are coming through their doors, work with our evaluation team, give a really strong understanding of how it is that they're implementing these programs, what assessment tools they're using, what specific strategies and interventions they're deploying, and how it is that they're looking at a young person leaving towards a safe, stable, and appropriate exit. As any research requires, we do have to go through an approval process in the Office of Management and Budget. So the study that Risa mentioned, the TLP evaluation, even our RHY, HMIS data standards, all have to go to OMB for clearance. So over the next couple months, what we'll be doing is working with our demo sites to identify the questions and the data points that we're going to collect information on. We have to submit that all up through HHS to the Office of Management and Budget to get clearance before we can start asking very specific questions and collecting information in a data format. So that's the TLP demo project. I'm going to transition quickly and talk about fiscal year 2017 funding. We're currently working on a continuing resolution. The federal government is funded through December 9th, 2016. What we anticipate is sometime before December 9th, Congress will put forward another continuing resolution that will carry sometime into the calendar year 2017. What date that is, we don't know. These continuing resolutions essentially keep the government funding for periods of time, chunks of time, until a final appropriation is passed for the entirety of the fiscal year. With the transition, we're not sure what that process is going to look like, what that timeline will be, but it happens often. Continuing resolutions are a standard course of business for the federal government in the past several years, and so there's not a tremendous amount of anxiety about ongoing continuing resolutions because it's something that we're used to. But I want to give you an understanding of what fiscal year 17 funding looks like through the lens of fiscal year 2016, because that's really the only place that we have to look to right now to give us any guidance on what fiscal year 2017's funding will look like. And just so those of you who are not familiar with the fiscal year calendar, the federal fiscal year starts October 1, 2016, runs through September 30th, 2017. So that's our federal fiscal year. So we are right now in fiscal year 2017. Looking at funding through the lens of fiscal year 2016, the RHY program had an overall appropriation of about $117 million. That included $53 million for the Basic Center program, about $47 million for the Transitional Living program, and roughly $17 million for the Street Outreach program. The law tells us, the statute tells us, that 90% of the money that we receive in appropriations, particularly for BCP and TLP, has to go back to the field, has to go out to you in the form of grants to the local communities and the nonprofit organizations and NGOs to support the work that you do, the basic centers, the TLPs, and the SOPs. 10% of that money we retain in the Family and Youth Services Bureau in ACYF to support all of the other functions associated with this program. So that includes RHYTAC, that includes the National Runaway Safe Line, that includes the National Clearinghouse for Families and Youth. It includes initiatives like the TLP impact study that Risa mentioned. It includes support for the RHYMIS contract and the efforts to implement the RHYMIS integration. So there's a lot that we have to pay for out of that 10% of dollars. Looking at the way that the funding was distributed in 2016, we received, and I'll give as an example, over 180 applications for the Street Outreach program. We had just over $8 million available in fiscal year 16 for Street Outreach programs. So we had a deficit of $26 million to cover all of those applications that we couldn't fund. Basic Center wasn't as significant of a difference, but it was still enough. We had what amounted to 200 applications, almost 200 applications for the Basic Center program, equaling almost $40 million worth of requests. Ultimately, what we awarded in fiscal year 2016 was not quite 100 awards, totaling somewhere in the neighborhood of $23 million. Part of our ongoing funding also has to support those grants that we had awarded in previous fiscal years. So in fiscal year 2016, we had to make awards, for BCP, SOP, and TLP awards that were originally awarded in 2014 and again in 2015. We call them non-competing continuations. That means the available money for fiscal year 16 for new awards is reduced by the amount that we had to put out through the non-competitive continuation process. And I'm giving this all to you so that you have some understanding of the way of our fiscal process works, how the money comes in, how the money goes out. Because I know that oftentimes, particularly if you're a longtime grantee and you receive the notice that you weren't refunded, there's an immediate reaction. Well, I've been a grantee for a long time. Why didn't I get awarded this year? Often it's a byproduct of the amount of funding resources that we have available and the level of competition that takes place on an annual basis when we're looking at hundreds and hundreds of grant applications and having to make decisions about who's going to receive those funds. So, with all that in mind, what do we have coming forward in fiscal year 2017 once we have our final appropriations in place? We have a lot. We have a lot of funding that we have to take care of. The Basic Center program is an annual process. Street Outreach program is an annual process. For the first time since 2014, we'll be funding new transitional living programs. But also in 2017, the Runaway and Homeless Youth Training and Technical Assistance Center cooperative agreement that pays for all of this and all of the TA that you receive that is currently with National Safe Place. That current cooperative agreement comes to an end, and we have to put out a funding opportunity announcement to identify an organization to run and maintain the Runaway and Homeless Youth Training and Technical Assistance Center. Similarly, the National Runaway Safe Line is up for competition again in fiscal year 2017. And while it is not a grant or a cooperative agreement, we currently have a contract with JBS International, who is responsible for our National Clearinghouse on Families and Youth. So anytime you visit our website, anytime you see information disseminated from us about a variety of youth and family topics through NCFI, that's all through the NCFI contract, and that contract is up for bid also. So we have a lot going on in 2017, and we're going to do our best to communicate to you all when these funding opportunity announcements are available and the process that we're going to follow to get the money out the door. But we didn't want you to walk out today not having some information about how the funding process works, as well as what to expect in the coming months, particularly as the appropriations are solidified and we know better how much money we have and what time frame we have to make those awards. So with that, I think we're going to open it up to questions. Rita?
Sure.
So before we open it up to questions, earlier today I shared with you that we have participated at FISB on several work groups, federal collaborative work groups to strategize about ending youth homelessness. And I think it's worth you knowing a little bit about the HUD work groups and maybe a couple of the other ones, just to let you know that, you know, the needle was moving. You know, especially let's concentrate on HUD. I think that we've come a long way from where we were last year with their understanding and awareness about our programs and the needs of our runaway and homeless youth. So I want my staff, my team to kind of give you an update on some of the work groups they're working on and some of the ways they see the needle moving, whether it be language added to funding opportunity announcements at HUD, or just the way that HUD is working with the COCs and the information they're giving them about the COCs, about coordinated entry for our young people. And I'm going to ask Kimberly Wortley, I'm sorry, I have Kimberly Waller. We have a Wortley and a Waller. Kimberly Waller on my policy team to start that conversation. Peter may have something else to add as well.
Great, yeah, thank you, Debbie. So we kind of one of the first things that I stepped into in this job was interagency work. I think we hear a lot about, like I had said in my previous remarks, silos, and I came directly from the local level, doing policy work on the local level, and so it was I knew we were siloed, but I didn't know really how it functioned here, and we have been really actively breaking some of those down. I see my HUD colleague over there, Sarah, so some of those work groups, I can give you kind of a couple of examples. One is an interagency work group to end youth homelessness. This has USICH as the leader, and it has all 19 agencies, so this is Department of Labor, Department of Justice, HUD, HHS, and HHS, you know, I mean, it's not just us, it's not just FISB, it's SAMHSA, and CMS, and you know, I mean, this is a huge initiative with so many systems, and I think we all know that our youth aren't just involved in one system, they're involved in multiple systems, and so this group is really designed to do a variety of things, including kind of your general information sharing. I think it's really hard to understand what all these agencies are doing and understand different lingo, and so building those relationships and breaking down those language barriers is a huge thing. Also putting out joint guidance and policy. So this goes into another work group that I've been pretty actively a part of, which is Coordinated Entry for Youth. And we recently put out a joint frequently asked questions document about what coordinated entry looks like for youth, and also plugging two breakout sessions tomorrow, one at 9 o'clock, which is Interventions to End Youth Homelessness. It's us and HUD and USICH, and people from CB will be there, Children's Bureau and the Child Welfare side, just to have kind of that dialogue about what are these interventions, what are the funding streams, what are the systems that are involved, and having that just kind of open conversation about what's going on in communities. And that was a direct result of these interagency work groups that I've been part of. And then the other thing too that I think is, again, important to reiterate is part of those conversations is learning about what other regulations are coming out from other agencies. So things like HUD coming out with new regulations or new NOFAs, their version of the FOA. I had to learn all of this government lingo whenever I first started here, so I feel like I'm a pro now. But so their notice of funding opportunity announcements, that's right? And being, actively a part of that process, and kind of figuring out where we can best move together. There's a lot of funding streams that impact our youth and our families, and so if we can find ways to lift up the work that we're doing and the value that we bring and the knowledge that we have about what works for our youth, that has been especially the policy team and Peter as well, because data is so interconnected with it, our role in just really plugging ourselves into those work groups and sharing the knowledge that we have and the work that our programs are doing, and just kind of pushing the needle. And I think all of us know every bit of information sharing helps, and relationship building is huge. So, Peter, do you have anything else you want to add? Peter does not have anything to add. Okay, Risa.
So, also want to talk a little bit about the work that we're doing at the leadership level across all of the federal agencies. So, as many of you know, Secretary Burwell became the co-chair of the U.S. Interagency Council on Homelessness. And so we have been having multiple meetings with the Department of Education, with Housing and Urban Development, with Department of Labor. And so that has been a really integral part of the work that we're doing as Kimberly mentioned, in terms of breaking down silos. And I think we have had numerous discussions with our federal partners on transitional living program versus transitional housing. And I think we have worked in partnership to make sure that youth, and the work that we're doing with youth are making sure that it's age appropriate, developmentally appropriate. And so also looking at how do we work to serve youth who are over 18 versus youth who are under the age of 18 who have different requirements. And it's a very important part of the work that we do. I think for the Runaway and Homeless Youth Program and the integration with the HMIS system, we've been working closely with HUD on that. We have Karen de Blasio, who will be coming tonight. She'll be here as well. We've been working not just with HUD staff, but we have an assigned TA provider for the Runaway and Homeless Youth Program as part of that. Michelle Budzik is also here, and we're working closely with them as well. And I think we're at a point now where we're working to disseminate information, not just through RHYTAC and through our National Clearinghouse, but through the HUD Exchange. So we're sending out joint message all across the nations. We also had the opportunity to, in October, to educate a lot of the continuums of care and the HMIS systems administrator as part of their conference, to educate them about the Runaway and Homeless Youth Program, which was really critical for us, because I think that the whole integration of RHYMIS with HMIS although we've been promoting that, I think at the COC's level, they needed to understand how our programs work, what are our funding streams, how can we better serve youth as part of the Runaway and Homeless Youth Providers now being a part, for some of you, for the first time, being a part of your local COCs. And so we had a discussion that was hosted by the National Network for Youth on youth privacy, and we had a really rich discussion about that. But we also were able to educate at a plenary session the work that we're doing, as well as the data. And we did lift up a little bit of our street outreach data collection report as part of that to demonstrate the power of having data at your fingertips. So I think overall we're on numerous youth homelessness work groups now that we've never been at before. And I know when I joined the Family Youth Services Bureau 4 years ago, I think there were 2 that we were a part of. we're at the table at so many more interagency work groups that it's definitely an opportunity to demonstrate that we have continued to move the needle, continue to educate our federal partners, and continue to educate um, our public and private partnerships. I know we've sat on work groups with Away Home America, and we were part of that from the beginning, and so it was very privileged to be a part of that effort, and as well as the 100-Day Initiative that I think you guys heard about a little bit more this morning. So it's a really rich discussion we're having at the federal level, but we're also having it as part of that public-private partnership, and I think that we need to see more of that. And so I think Commissioner Lopez talked about us breaking down silos at the federal level, and we see that you guys are doing it at the local level as well, and so really applaud you for that. But before I open it up to questions, I know Chris talked about the upcoming funding opportunity announcements and contracts, and I know that as part of our work with the advisory board, I know Debbie Powell opened it up, that we want your input. I know many of you know the Amtrak train, and they have the Acela. Well, we're on the Acela train because it's a fast-moving train, so we want to be able to find a forum for us to hear your voices and how can you inform the work that we're doing in terms of developing these funding opportunity announcements and contracts. And so any recommendations you have, we're willing to listen and to hear how you think that should look like. And so with that, I'm going to open it up to comments and recommendations in terms of how best can we work with you for you to inform the work that we're doing here at central office, and then open it up to questions as well. So thank you. And I think there's some mics going around. So I have Lori, TC, and so just raise your hands and they'll bring the mic to you.
Hi there. Quick question.
So could I just ask if you say your name and your organization when you ask a question?
Yes.
So,
Hi, everyone.
thank you.
My name is Pamela. I'm with Casa Youth Shelter in California. And my question is, in the paneling process to apply for the grants, it's my understanding that the panel is made up of many different professionals. Has the government considered or looked at moving forward to approach where the people reading the applications are all connected professionally to runaway homeless youth? Because it's my understanding right now, the paneling process can be teachers or people who have never actually worked in the field.
So what we do as part of that really good question. So what we do as part of the grant review process is we do look for experts in the field. So some of them may have worked as a runaway homeless youth provider in their previous work experience, but they're now teachers. Some of them have trauma-informed care experience. Some of them may have evaluation experience. So we have a well-rounded group of reviewers and chairs as part of that process. And so we really do take that seriously because we do have the opportunity to look at resumes, and we work hand in hand with our contractor to do that and look at the experience of the reviewers that are going to serve as part of our grant review process. So I don't think they can hear you, Debbie, so. So.
Hi.
I have a
and
comment.
So I'll just mirror what Risa said, but also I wanted to talk about teachers for a moment. Many teachers are working with homeless young people. Our young people, they go to school. And so they bring a very rich and awareness to our panel. So I just wanted to be sure that you understood when we pick a teacher, it's because when they put in their application, they told us specifically they do have experience working with homeless young people. So.
I have a comment. I'm Kevin Coleman with Covenant House, California, and I just want to first of all say thank you, because one of the challenges that I know we have is we need the money and they're not giving it to us, and you just told us why. It's very little money, and it's a lot of people asking for the same amount of dollars. Each year program costs increase, but the money doesn't. One of the things I learned earlier was to get on our elected officials and have them be advocates like, look, your office is fine. You do not need new furniture. We need money for this youth. So I just want to say thank you. That's all I wanted to say.
Thank you for that comment. I think it's always the recommendation to educate your legislators and to educate and bring awareness. We can't promote that enough because you guys at your level need to do that. We unfortunately, as federal career servants, cannot do that. So thank you for that comment.
Good afternoon. Cindy Williams with Loving Arms, Inc. in Baltimore, Maryland, and in South Carolina. I want to first of all say thank you to this panel. I've seen tremendous change over the last couple of years, and when we talked about the integration initially, it was very scary. It was frustrating for many of us going back to our states and not having our CLCs informed, and I can honestly stand today and say that our CLCs have gotten on board. Clearly, the education has come down. They are friendly to us. We are making strides, and so I want to say thank you for that. To answer the question, or to address the question that you put out about what might you do to help with the funding and what you can look at. In the last workshop I was in, one of the grantees mentioned in terms of, we understand the scoring process for funding, that you get these applications, you score them, there may be a number of people that may score 100, or you go down the list, but is there any consideration to looking at the number of funders in particular areas? Because I think one of them mentioned that they didn't get funded for this SOP this year, but there was a number of SOP programs maybe on the coast, but not in the northeast or west or wherever they were located. But is that something that you look at? That might be something you could consider, the geographic locations and whether or not we are having at least a SOP in each area.
So thank you for that. First of all, thank you for the comment, but thank you for the question as well. It's definitely, excuse me, it's definitely something that we can look at as we look at, as you mentioned, scores of hundreds and 99s and 98s. We're definitely open to the recommendations. I think that related to that, we talk about our SOP and we talk about our BCP, and there's a little bit of a difference with that in terms of our basic center program is although it's discretionary funding, we have state allocations, excuse me, and because of that, we're able to give funding to each of the states. It's not the same for our street outreach program or our transitional living program. And so not just for street outreach, but we'll look at that across for our transitional living program as well. So thank you for that recommendation. So I think while we're working for that mic to work, is there another question?
I'm Raquel McGriff from Through the Storm Outreach Ministries in Kingstree, South Carolina. And to piggyback off of what she just said, I was just wondering when there is maybe an influx of programs in Florida versus, say, South Carolina, why is there a barrier between the regions being able to, especially young ladies that are victims or a part of sex trafficking, breaking that barrier and partnering with bridging the gap between South Carolina and Florida?
So sorry, just can you repeat your question? Because I don't think I understood the second
If I
part.
had
in terms
a young lady
Mhm.
who I keep trying to help time after time, and she keeps running back to her victimizer, the person who is making her a victim, trafficking her. And if I can get her away from them and partner with someone, say, in Florida that has an influx of beds versus, my limited beds, why is there a barrier within a region, within the same region?
So I would say that it shouldn't be a barrier. That is an opportunity. That's really a rich opportunity for grantees to work together. And if we need to engage our Runaway and Homeless Youth Training and Technical Assistance Center in that, then a good recommendation, because when you have a youth that's in South Carolina and there are beds in Florida, why not? So, but I also implore you to go ahead and try to forge those relationships with your peers in the field who also have funding. So once we make the announcement of who's received TLP, BCP, or SFP funding, work to connect with those particular grantees to say, okay, I'm reaching out to you, I have an individual here, do you guys have an open bed? Can we bring that person out of state to your shelter? So I ask that you guys also make sure that you're partnering with your peers across the country. I know that we have our West Coast convenings that happen regularly. I'd like to actually see that across the country, and not just the West Coast, because that's the opportunity to engage with your peer youth service providers to be able to have those conversations as well. And so maybe it's an opportunity for us at the federal level to look at what's worked well for the West Coast convening and to start more of those across the country.
Hello, my name is Karen Torres. I'm from Los Angeles, California. I'm actually a former TLP member with LAYN. So I see that you guys are trying to collect a lot of data in regards to TLP with your STAR program. So what opportunities do you guys have for former TLP youth in regards to that?
So I think one of the things we do, and thank you for your question, and I really have to say I enjoyed the session that you presented at this morning as well. So what we try to do is work with youth as we work to develop these initiatives, is to get youth input, because the philosophy is nothing for them without them. And so we always want to have youth voices at the table in terms of piloting some of the instruments with youth. For example, we talked about having the summit with the American Bar Association. We actually had youth who have been homeless come back and be able to talk about that. So I would also encourage you to be a part of some of those advisory councils. So for example, the National Network for Youth have one, and I think we have Eric Maston and Amy Lutit here, and they actually have a booth out in the lobby. So go ahead and have a conversation with them and sign up to be a part of that youth advisory group as well. But we definitely are up. See, Eric just gave you his card, so thank you. So definitely encourage you to go ahead and be a part of that advisory board as well.
Can I follow up on the question from the young woman in South Carolina? Could you share with me what barriers you see to that? Did you feel that there is some programmatic barrier to you reaching across to your peer in another city or state to ask for their support in providing shelter for a young woman who's going into their state?
When I inquired about it, in fact, I tried to put it in the non-compete grant, writing our project officer about it, and I was told that it absolutely could not be done. We needed to write an entire separate grant, and so did the person that we were partnering with, vice versa, because we had to stay within our guidelines of the grant.
Oh, I see.
And if we did not include it, we could not do it.
Okay, I kind of understand more now. You're meaning, conceptually adding it to the design of a program versus you knowing there's a need in your state or your city and you reaching across on your own to do that. So I kind of understand now. But yeah, we can talk more about that afterwards. But I think Risa was your response okay, where it says that you guys can do that on your own? If you look on our website and you find there's a grantee that's in the state or the city that your young person is going to, you can reach out to say, I have a person coming over there, can you connect them with resources? You know that's allowable, right?
Yes.
Okay. And I did want to also kind of follow up on your question about geographical distribution. And as you look at our FOIA, we definitely have that in there that says, the commissioner can make a geographical distribution or skip. And we have done that when New Orleans had the flooding. We did that. We skipped a couple grants to reach, applications to reach New Orleans, but we don't do that as a routine. We probably could do it more, but if you think about it, if we skip you and make a decision to go to another state, Philadelphia, it becomes very subjective unless there's some kind of catastrophe that's happening in a location where everybody clearly sees that this area had a hurricane or flood or something devastating happened to that region or that place where they definitely need supply services there. But yes, we do have the authority to do geographical skips, but we really, try to be as objective as we can and do it based on score, because that's what we say we're going to do, unless we clearly know there's something that's really happening traumatic in that location.
Darryl Cribb from Loving Arms, Inc. Last year, we just brought up, thank you, and commend you for the great work you're doing. Just the street outreach program, can we do that for 5 years instead of 3? Basic Center program, do it for 4 instead of 3. The transitional living program, we'll just leave that as it is. It already got 5 years. We're trying to bring the other programs up to 5 years because in reference to the street outreach program, it takes about 3 years to educate, to do the groundwork, and really get it started. And data, money follows the data, and we're starting to do that now. Thank you. But if we can move it to 5 years, that would be awesome.
So, good question. I wish we could move it to 5 years. Unfortunately, we're constrained by our legislation that caps our street outreach and basic center at 3 years. But you can do the work to educate your legislators that you want to see the increase from 3 years to 5 years or 4 years. And I encourage you to do that. I think as we talk about reauthorization of the Runaway and Homeless Youth Act, it's a good conversation to have as well as part of that reauthorization piece.
My name is David Mount from Seton Youth Shelters in Virginia Beach, Virginia. As we move forward on the end youth homelessness in 2020, we have an apparent disconnect in my community within the continuum of care and how youth are approached and how they are seen, how they're evaluated, and how their homelessness is prioritized to get off the street. And so this disconnect seems to be not only at our own level, but at a federal level. When you talk about the joint meetings and the integration of efforts between many different organizations at the federal level, is it possible for us to get a better definition of homelessness in order for continuums to function more clearly across the baseline as opposed to functioning only from a literally homeless state and a very narrow definition at the HUD level? And because our disconnect seems to be in our continuum from the HUD-funded streams, not only at a federal level straight to our city, but also to the state level that's filtered down to our cities to end homelessness in our own communities.
All right. So thank you for that question. And I know we've had numerous discussions at the federal level about the various definitions across all of the federal agencies. And I think we've had some proposals that came out of that. But also know that there's some of us that are really constrained by our legislation in terms of how we define youth. So for example, you know that I believe it's HUD that goes up to 24. We go up to under age 22, and so that's a disparity there. But I actually would encourage you all, if you want to see that definition change as it relates to age, that you guys continue to educate about the need for, and using your data at the local level to be able to educate your legislators about that. I think I had a conversation with someone earlier about serving youth under the age of 18 with their street outreach program. And so it's that you're not constrained by that for the street outreach in terms of age, in terms of the lower age limit, but you are with the upper age limit. And so it's also having that discussion with your COC. I know there's some people that are doing it more successfully because they've had longer term relationship with their continuums of care, but I'd also implore you to go ahead and connect with some of them, and we're happy to make that connection as well in terms of how it's being implemented at the local level, despite the various definitions, because I know there are some best practices out there related to that as well. But again, related to the age and to serving youth, It's definitely continuing to educate, educate, educate. I know we're trying to do it at the federal level in terms of educating the continuums of care and the system administrators as it pertains to the needs of runaway and homeless youth. But I think it needs to be done at the local level as well. And I know you're probably doing that, but I think at some point in time, it's going to click when they're hearing it coming from multiple directions.
It's not an age difference in our continuum so much. We all understand the issue of youth being 24 and younger, and we identified that. It is the literally homeless status and chronicity status, or chronically homeless, that prevents our youth from getting in and being prioritized in our continuum to get off the street. So it's that vulnerability and their age, and they don't fit into any unique group, even though we are using the central intake and assessment approach at this point in time. I realize each continuum has the ability to make some distinguishing features for their own central intake. But when we are told, or when your RHY organizations are told they are not eligible for services and their youth aren't eligible for services because of the HUD definition, it's very difficult to argue that within their own continuum. So there seems to be a disconnect in the definition of how to prioritize or how youth are prioritized, even though they are currently on the table.
So, sorry. Mr. Mount, we have what is a very thoughtful document that you submitted to us that if you wouldn't mind giving us the opportunity to read and digest and then circle back with you to sit down with not only your regional specialist but the regional program manager and have really a more in-depth conversation about the unique situation that you're facing, that would, I think, give us the opportunity to be more reflective and responsive to your comments. Great.
Yeah. So I also just wanted to step in on the intake and coordinated entry piece. We've been working a lot on the prioritization issue when it comes to youth and coordinated entry systems. With regard to that issue, we have heard that from other communities as well, and I would actually invite my colleague Sarah from HUD to offer any thoughts. She kind of gave me the, hey, I'm happy to say anything. Yeah, you can come on up. Because, you know, I think that this is a really crucial issue, and it's also kind of putting a plug. We're having a coordinated entry for youth conversation tomorrow, too. So, but anyways.
So I'll be in the plenary tomorrow and was expecting to get that question tomorrow. So we'll do it today and we'll do it tomorrow. We'll have the question pointed at HUD about the definition. So I mean, there's a couple of things that I want to hit on just briefly. I know that we're running out of time here too, right? So so the work that we've been doing together and the teams that we've been sitting on, we've been putting together at the federal level kind of a broad plan on what it takes to end youth homelessness, and that includes a bunch of different programs, right? That's your continuum of care programs, that's your RHY programs. It's actually, in some ways, what we've been trying to do is vision for what's missing and what comes next, you know, in the absence of what we don't have currently, and still kind of understanding the world that we currently live in with the COC programs. The COC programs are designed specifically to get to young people and adults who are living on the streets, and that's what you're seeing by folks who are literally homeless. And the reason that it's set up like that is because there are a scarce amount of resources in the COC program. I know it seems like a lot compared to the RHY program, but when you pull it out across the country and you look at how much is going to housing, it really is putting a scarce amount of resources into communities to actually build specifically housing programs. And what we've been trying to do is think about how other housing programs can play into that. And when we think about all the 4 outcomes that we're trying to get to from the USICH framework, we want to be able to hit all 4 of those outcomes. And we know that HUD's probably, the COC programs aren't going to be able to get to all 4 of those outcomes necessarily, that we've been primarily focused on housing, right? So we're trying to just think about where we are now and think about how we pivot that over time. The other thing that's happening in your communities is that the COC programs that have been coming online over the past several years have been directly focused on Category 1, which is the literally homeless programs. And what you've seen us do over the course of the last 2 years is to pivot when we're talking about youth to both Category 1 and Category 4, which is young people who are experiencing violence too. And so they can be living in all different sorts of situations and be considered homeless. And we can get into the nuances of the other parts of the definition, other categories of homelessness that we use at HUD, other than literally homeless, but the challenge is a delay in the programs that are coming online and the way that we've been kind of messaging on future programs to actually get them out into the field. So I'm happy to talk more about this in length, and it's really complicated stuff. The two things that I would just want to highlight is there's a webinar on the USICH website about this issue, particularly about the different categories of homelessness. That's a really helpful resource, and then we also put out a document to explain those different categories and explain how it actually plays out in your community in terms of how your funding announcements, how the NOFAs from HUD actually determine which kind of projects get funded for which types of homelessness and all that stuff. So I am totally accessible to everyone in this room, and we'll talk at length to anyone, including our partners here and you all, about this question, and we'll go probably toe-to-toe on it a little bit, because I'm going to stand my ground on kind of where we are and where we think we're headed, but I'm absolutely open to hearing your comments and hearing exactly how it's playing out for you in the field too. So with that, and I'm sure that there'll be follow-on questions tomorrow in the session that we're doing. So, and I'm happy to take those too.
Thank you, Sarah. So I wanted to take a moment to close out this particular session in a slightly different way than we actually had originally thought of, for all the reasons that you've just heard, including Sarah. And I want to bring a component of the conversation we had, I guess it was now 2 hours ago, where we had a session with executive directors and presidents and CEOs of organizations, and they had this hour-long conversation with me, and I said it was about the topics that you wanted to talk about. And towards the end of the session, all of the same questions in that room are the ones that have been brought up in this room. So I want you to understand that you are all thinking alike in terms of the kinds of questions: the funding, the rules, the data, RHYMIS, HMIS, the budget, what's going to happen, all of these kinds of, in some ways, anxiety-provoking issues. But towards the end of the session, I received what I thought was, in some ways, one of the most profound questions, which essentially said, is solving youth homelessness still a bipartisan issue? And why that question matters, not just then, but as I sat here listening to your questions, is resoundingly, yes, it is a bipartisan issue. How we get to solutions may not be, but the fact is that solving and ultimately ending youth and family homelessness in America is possible, and it's going to take a different way of imagining how all of us do our work. So what Peter and what Kimberly and what Risa and what Chris said, they are on the receiving end of requests that ultimately come in daily to our office from the Hill. So raise your hand if you've worked with the city council in your local community. Right. So the Congress and the Senate are our city council. Every day we get asked a variety of questions. I kid you not. And they funnel down a chain that ultimately ends up in one of their inboxes that says, Senator X from County Y and State ABC wants to know if 18-year-old young women who live in this neighborhood are getting addressed with this issue, yes or no? That happens almost on a daily basis. You heard a variety of versions, from the money to the data, et cetera, and I want to be clear about one thing that is easier for a political appointee to say than a federal career civil servant. While it's not legal for me to ask you to lobby our Congress, as a Senate-confirmed appointee, I cannot do that. I can ethically talk about the importance of education and advocacy at the grassroots level. So I'm going to pick up on the question Karina asked us, Karina, right, from Los Angeles. There is nothing more powerful than telling the story of a young person from their voice, not the voice of the president or CEO of the organization that received it, but from Karina's voice that says, this is the kind of help I received, and here's why it mattered when I was 16, 17, 18. And I went to Safe Place, Debbie Powell, and she was my social worker, and as a result of that, I am now in college, safe, etc. Every single day in our inboxes, particularly mine, we have a series of media clippings from all over the country. And there isn't a day that goes by where one of those news clippings in your programs might completely change my and our team's day to respond to the secretary, to the Hill, or to the president. I'm saying these things because, as I said in that room, it is much more important to be candid and transparent about the way these things move. And to that point, not a single one of the questions that were asked a couple hours ago or in this room will matter at all if RHY, the Runaway and Homeless Youth Act, isn't ultimately reauthorized by Congress. Now, that's not a partisan issue, because let's be clear. So if you don't know in this room, the Runaway and Homeless Youth Act is not reauthorized right now. There have been multiple attempts in the last year and a half, 2 years, that were not successful. One could argue from here to kingdom come about the strategy that worked or did not. That is, to put it just in black and white terms, not the job of our federal career civil servants. That's not to say they're not going to be engaged with you, but it is a political proposition that at its most powerful element begins and ends with you. And if we are not all engaging multiple layers of our elected officials, as my brother said over here in the blue shirt, I didn't catch your name, Kevin? There we go. Then we are not doing our jobs. Because let me be clear, when the data comes back for the 9 demonstration grants or the others who are doing the long-term TLP, that information won't even come back until the fall of 2018 if we're lucky. And when we get questions like all the time, and I'm not exaggerating, you can ask any of our federal staffers, you can ask Sarah, the Hill will ask us, what happened to that $30 million carve-out that Congress gave to HUD to do a youth demonstration pilot? And I brought this up in the other session. I said, good for HUD, bravo. Why? Because they didn't have to do that. They chose to do that as a result of the years of partnership building that has been going on with FISB specifically and HHS. I don't know if my colleague Jenna Knistra is here. You'll hear from her tomorrow. That has been intentional bridge building with the Department of Education to think about how this works. And if we, not us, not you, if we cannot demonstrate the impact of those dollars, however scant they are, and that is legitimate comment that my brother Kevin made, which is that in the grand scheme of things, we will not be able to solve youth and family homelessness in the grand scheme of things with just $135 million roughly. And that is why, and this is where it does get political, and I am an appointee of the President of the United States. He proposed to Congress a significant proposal to actually invest much more broadly in ending homelessness writ large. Now, you can decide, whatever you think about the politics of the day, where to run with that. But it's much more important to be candid and transparent and direct and honest about how this works. I think the 4 of my colleagues here did a really good job of sharing with you behind the curtain what is moving. That train has left the station. The RIMUS HMIS integration, that is decided, it is done. How we implement it, that is our work. If you have challenges, we are here to help. Our job is to help you. Secondly, if you are waiting for permission from anybody, from FISB, from HHS, to step up and organize amongst yourselves, with us sometimes, and many times on your own, across states and across this country, deputize yourself right now. Because it will not change the budget, the data, or the investment. It will not grow with COLAs and others unless you help us all get there. That's not about lobbying Congress. That's about a longer-term running an agenda on youth and family homelessness. And that won't be solved by any one rule, any one report, or any one grant cycle. Now, that said, when you are amongst yourselves as these kinds of convenings, and I said this to the group earlier, we have to take advantage of every single second we have to build bridges, build relationships, and to organize. That might be taking up Sarah's offer. Sarah should not leave here this evening without at least a couple of you saying, Sarah, help me understand that decision. Why did you do that? I don't understand. Or, Sarah, I don't agree. Or, Sarah, I agree and thank you. Each of those are completely legitimate. And in the discourse of American democracy, disagreeing with someone can be done in a civil and respectful way, such that the result we seek to end youth homelessness is ultimately what we all do. Disagreeing more civilly, or with greater civility, getting to understand transparently what we're doing, a radical transparency, as I told that group over there, of I would, if I had a magic wand, put all of your applications, all the review processes online, so you could see it all in one fell swoop. Because what we know is that the consistency of quality and results is all over the map. That's not to shame or blame anybody. That's because we all want to succeed in this world. There is plenty of work to do, and there's plenty of organizing that we have to do. So I wanted to close out this session again thanking you, not just for the work you do every day, but when you leave this room tonight, including at that reception, which, by the way, I didn't know about fireworks. We didn't pay for them. The federal government did not pay for those fireworks. Just so we're clear, right? Just so we're clear. That you take advantage of every single second you have. I don't care what your title is or what your role is, because you're here. And what that tells me is that you care deeply about ending youth and family homelessness in America. And if that's the case, you organize, you organize, you organize. That's how we make a difference. With that said, have a wonderful evening. Enjoy the non-paid fireworks from the federal government, and have a good time.
It works.